So I'm really delighted to be here. It's been really interesting for me to hear Candace and Michael, and as they were talking, I was trying to think about how each of their talks actually is applicable to some of what we're doing, but what I'm going to be presenting is completely different. So hopefully it's not the high-tech kind of platforms that you've been seeing. It's about the common man and the fact that I do learning just the way Candace does, but it's about how can residents learn about their health to stay well enough to stay out of Stanford Hospital. That's my mission. That's the mission of the Stanford Prevention Research Center. Don't tell our dean that, but that's what we're shooting for. I have a few presentation objectives. The first thing I'll do is just describe what we're calling our citizen science community engagement platform. That includes a very simple tool called the Healthy Neighborhood Discovery Tool. And as I'm talking about this, we're looking for new applications. So what I'll be presenting are applications in the health promotion, disease prevention space. But you all work in very different spaces, and there may be other kinds of applications for this kind of citizen science engagement work that we'd love to hear about. I'll highlight some successes that we've had thus far with this simple platform and some of our future directions. So just to tell you a little bit about us, I'm the director of the Healthy Aging Research and Technology Solutions Laboratory here in the medical school. And I'll just tell you a little bit about our passions and our themes. We're very interested in healthy aging. This is what Martha's going to look like in about 50 years. Borderless health promotion, which means really customized solutions that transcend geography and politics and everything else that we can transport around the world. Policy engaged citizen science, which is what I'm going to be focusing on primarily today. And then our ultimate goal is really to reduce health disparities. As you likely know, the U.S. is in the embarrassing situation of spending more money for our healthcare system than anybody else on the planet, and we have terrible issues with health disparities. We're ranked quite low in terms of that. So we can do a lot better. This kind of research, like a lot of our research, it takes a village. These are just a few of my collaborators worldwide as well as here in the US. So just by way of background, since I know that you all come from all kinds of different sectors and backgrounds, lifestyle behaviors are my passion. I'm a health psychologist, a clinical health psychologist by training, and we know that lifestyle behaviors are one of the major drivers for so many chronic diseases that are the US's #1 killers. And many in the US as well as globally are insufficiently active, eat poorly, are overweight, smoke. We all know this, but it doesn't help to know it. So what are some solutions that can transcend knowledge and information and transport us into action? One area has to do with the environment. When you go into your doc and you talk about your risk factors and they ask you about your health behaviors, do they ever ask you about your neighborhood environment? Do they ever ask you about your social connectivity? We know that social and environmental determinants are the single best predictor of how people are going to do in terms of their health, yet it's not part of what we tend to focus on in the healthcare system. And the other issue about this is that many people here in our own country as well as worldwide really don't have a voice to change their social and built environments. And that's what we're trying to do with the citizen science platform, is empower regular people to be able to change their neighborhoods, change their environments, and hopefully promote health and well-being. So one of the solutions we're testing is we're combining residents as citizen scientists. We're giving them very simple but empowering mobile technologies. We're teaching them about a community engagement process, And hopefully the goal is to build community capacity to drive social and built environment improvements, which in turn should translate into better, healthy, long-lived lives. So what is citizen science? We hear this all the time now. It's interesting, I did a little research on this, and it goes back centuries with people like Thomas Jefferson, who was recruiting people to look at weather, to record weather, centuries ago. So today, I've identified at least 3 general types of citizen science that we see in the healthcare field and in the health field. One is what I call citizen science for the people. And this is the thing that I think is getting the most focus these days by our federal government, by Obama's precision medicine initiative, which has to do with donation primarily of biological specimens, your DNA, your tissue samples, your blood samples to promote science. So I call that citizen science for the people, because it's a passive involvement on the part of citizens. The next is citizen science with the people. This we also hear a lot about. It has to do with involving citizens in active data collection, and the most popular forms are in the ecological and biological sciences in terms of counting birds, so the Audubon great bird, backyard bird counting initiative that happens every year. People count all kinds of things in the biological space, and sometimes also in the built environment space as well. So the third one that we care most about at this point is citizen science by the people. So this involves engaging people to participate in actually setting their own scientific objectives with us, collecting and helping to interpret the data that they collect, and then helping, and this is the important part, helping to build solutions. So thus far, I'm going to tell you a little bit about what we've been applying it to. And again, I want you to think about, is there anything about this kind of process that could work in my space? So we've been applying it to really looking at under-resourced residents. So these are residents living in low-income areas that do not have, in poverty and these kinds of areas, and they don't tend to have a voice in what's happening locally to improve their health. And we focus specifically on one of my passions, which is active living and healthy eating. And I haven't taken a look, Martha, at the food choices out there, but I am sure they're completely healthy. We're doing a lot of sitting. If you hadn't just come back from a break, I would have had you stand up, because we know that prolonged sitting is dangerous to your health. And we're trying to get people up. So what we tend to do, and Martha hasn't done this yet, but I would encourage you in mediaX things, is what we call active applause. And maybe you can start with me. That would be fun. Which means that, well, close, but no cigar. That's not active applause. Okay, we'll practice it really quick. Active applause is when you stand up and applaud. So let's just practice it. Stand up and applaud. Okay. Okay. So it gets people out of their seats about every 20 minutes, which is exactly the kind of breaking up of sedentary behavior that we know can really help. 5 minutes left? No? Okay. Woo. I better keep rolling. But we can practice it at the end of my talk, okay? Okay. So we want residents to prioritize issues that are feasible and low cost, which is very important. They learn how to build partnerships, and they learn how to advocate for change. So we developed this initially at East Palo Alto with their older adults, the seniors who live in East Palo Alto, one of the most diverse cities we have in the San Francisco Bay Area. And we gave them a very simple app-based, electronic tablet-based tool called the Discovery Tool. And what they do is they take this Neighborhood Discovery Tool app for a walk, and it helps to guide them to capture barriers to walking and food access as they walk with this app. It's GPS enabled. It's geocoded. They take photos and they narrate their story about the important barriers that they're finding socially and in their own physical environments that impede their ability to live healthy lives, to be active, to get the kind of food that they would like to access. And then the goal is to teach them how to come together, build consensus about the most important issues in their neighborhood, and then to be able to relay that information in a compelling way to policymakers so that realistic solutions can be developed together, not by academics, not by the policymakers, but by this triad of people and policymakers with the researchers there to support and facilitate. So when we were in East Palo Alto, the seniors there came up with a couple of really important issues. One is how to get across streets safely. They were being told by the transit group there that, oh, there's no speeding in your neighborhood, but the seniors knew differently, and they actually stood out there and collected information to show that, in fact, cars were speeding in their neighborhoods, and they lacked public transit access to get to buses and such to get to where they wanted to go. So long story short, these tech-naive seniors who had never touched any kind of technology before were able to learn how to use this very simple tool to identify the barriers in their neighborhoods and to advocate for changes with their local city council and planning department. And in response, we were really gratified to see that the City Planning Committee and the City Council actually made changes in East Palo Alto in part due to this process. And this included things like revising the streetscapes and the pathways, retrofitting some of the sidewalks, improving access to the senior centers so these seniors could get there. They helped them to create a senior garden so they could start growing the kinds of vegetables that they weren't able to access before then. And then there was a comprehensive sidewalk inventory and repair program. So we were very encouraged by this, because if it can happen in East Palo Alto, why not other cities, not just here in the US, but around the world? Another place that it's being used right now is by the Santa Clara County Public Health Department. And in particular, they're using it to try to make it easier and safer for kids to bike or walk to school, which is a major, not only a national problem, it's an international problem, where you have parents driving kids to schools. It's dangerous for the kids, it's not healthy for the parents, and so they're using this process and having the students, the parents, and the teachers actually captured through very simple photos and narratives what's going on and trying to get to school. This one in particular was done in Gilroy. And what are the threats to safety? And those three groups are now working together to enact realistic solutions. We're using it for food access, which, as you know, in the US for a growing number of the population is a huge issue, as well as an issue worldwide. And we've partnered with some interesting, diverse partners. Our lab has partnered with the Google Innovation Lab for Food Experiences, which is a phenomenal group of multi-sectoral foodies. So these are people that touch all aspects of the food system that are involved in helping us think about solutions. And we have the local markets involved, and we have the Santa Clara County Public Health Department involved, and most important, we have the residents involved. These in particular, we're starting with are we already done? No, okay. Low income residents who are Latino in Santa Clara County. So just very quickly, we have individual level and neighborhood level targets to be able to teach people what it means to have food literacy, to understand where your food comes from. Sustainable, healthy food is the goal. For the first curriculum part, as you might imagine, it has to be bilingual and culturally adapted to people so they understand these issues. At the neighborhood level, people are walking around their neighborhoods with the discovery tool, And they're doing this at home, in their neighborhood, and in their local community center. So I just want to share a few of the other kinds of programs that have been using this kind of process throughout the world, and in some places in the US. So we're doing some food access things up in North San Mateo County, where there have been successes there. There have been successes in our Latino neighborhoods here in the Bay Area. It's been applied in Mexico to very impoverished neighborhoods where for the first time residents are coming together to solve solutions that they don't have the ability to have policy people, decision makers solve. They don't have that access the way we do in the US. In Israel, it's been phenomenal what they've done in 4 different communities, both with Israeli Arabs and Israeli Jews. For the first time in one of these neighborhoods, they were actually sitting down together to talk about common issues and common barriers to active living and healthy eating. It's being used in Bogota, Colombia, to look at different kinds of recreational offerings, and in upstate New York as well. So the vision is really to think about what other kinds of populations and settings could this be used in. Google is very interested in using it in their corporate setting, especially around food issues there at Google. You could picture it in clinics, universities, all kinds of places. And you can picture it for a wide variety of problems that don't have to just be about health. They could be about workplace productivity and performance. They could be about disaster preparedness. There's all kinds of things. So the ultimate goal for us is to really seed the idea of a center on citizen science for living well, with the objective of really taking advantage of US and global interests in this area. And this is what our network looks like today. And I hope in a year, when I show this slide to Martha, we'll have doubled the number of participants. We're on every continent, and we're hoping to try to expand to almost every country if we can. So this, just to end, I need to end probably really soon, right? We're very gratified this year to be recognized by the Center for Active Design, which is an international group in New York City. And they chose this citizen science model as the 2015 Research Award for Excellence winner in creating some innovative ways to really promote public health. So I'm going to just run through these slides very quickly. It's obvious, I think, that what we love about this process are the synergies that you get among different sectors. It engages people in all kinds of ways. We purposely made this so this will be the simplest technology you'll see all day, I can guarantee it, because it's got to be simple for people who are tech naive to be able to use. And there are all kinds of ways to engage people, and that's not necessarily an easy process, but it's a very doable process. So we're looking forward to developing more intersectoral teams, especially with the private sector. Google's helping us with this, and to really use this to transform things in relation to health disparities so that everybody can live healthy, active, productive lives. Thanks very much.